Well, again, thank you all for making some time today. Really excited to talk a little bit about diaper size projection, specifically at distribution sites. This is for partners who are actually implementing the program on the ground to individuals who are receiving the resource. Uh, just a couple quick notes. This meeting is being recorded and transcribed. Um, we should be able to share a copy externally to all of you following ACF's approval. These will also most likely be posted onto the website for future use. So you can always revisit and come back to them. If you have any follow-up questions, feel free to reach out to Christian or myself, and we would be happy to answer them or set up some time to chat in more detail about them. My name is Justin Van Zerber. I'm the Director of Programs with supplybank.org, and I've been overseeing diaper program distributions for about 5 years now. My colleague is Christian Browning. She's our outreach and special project manager. She's the point of contact within SBO for our training and technical assistance contract with ACF. So if you have any specific questions, reach out directly to her. Christian at supplybank.org, and she will funnel you to the appropriate person. I don't see any ACF staff on the call, so I think we'll just dive right in. Here's an overview of what topics we'll go over today. The objective here is to understand the importance of us estimating diaper size use at your site and strategies to be successful in ensuring participants are able to receive their correct sizes. Each topic, as we go through them, will have different considerations. I will leave ample time at the end to discuss and have layered some questions in throughout the presentation to kind of prompt some conversation between all of us. We are continuing to learn, and I think the best way to learn is by engaging and speaking with others. Want to recognize that each program is unique, and it's very important to take that into account. Some of your barriers might not be barriers for others, and so being patient as we walk through this information, as some of it might pertain to your site and some of it might not necessarily be specifically relevant. Again, just want to reiterate, following the presentation, if any additional guidance is wanted, reach out. We're here to support you in any way that we can. So first, I want to dive into why it's important to project your needs accurately. Distribution sites will want to have the correct amount of sizes on site for each participant when the participant is scheduled to receive diapers. Your site will want to make sure that participants have the correct size available so that they do not need to return at a later date to collect diapers or have to use a different size. Not having correct inventory available can lead to health issues with the child, as well as reduce the likelihood of continued participation in the program. As your site gets better at projecting their needs, this can reduce the frequency of deliveries needed and thus saving the program money. The less frequent deliveries that need to be made allow for staff to focus on the core of the program instead of trying to round up staff to assist in moving the diapers to their storage location. Accurate projections will also assist the procurement team by allowing them to procure more diapers at one time with the intent of being able to save money on the product, shipping, and storage, as well as reducing the amount of excess inventory they have to store. Since this program is designed for a 2-year implementation period, you want to be precise with requests to make the most efficient use of funds. Accurate projections will allow for changes in a child's size, as well as offer opportunities for emergency allocations. It's really important to think through all the ways diapers can be distributed and to whom to ensure all participants will be covered. You may not know the exact size for all of your participants at the beginning and may need to make estimates before all participants are enrolled. We will walk you through a couple guidelines to help with that later in the presentation. As we're well aware, babies are constantly growing and at very different rates. In a future slide, I'll talk about the rate of growth and how to project based on those averages. While the caregiver will know which side fits their child best, it's important to think ahead. If you are only receiving diaper deliveries on a quarterly basis, you should think about what size that child may wear in 3 to 4 months' time. Additionally, some participants will not show up consistently, leaving excess inventory on hand. Your team should collaborate and understand how you want to reallocate or save those resources. Do you make those diapers available to the next person on the list or on a first come, first served basis? Or do you hold those diapers for the next distribution to double up for that original family? It's important to find a way to track those inconsistencies because if they're included in your monthly projections, it may significantly throw off your current needs. For example, thinking month to month, if you have 50 participants and 10 of them miss their appointment but show up the next month, your data of each of those months will look very different. One with 40 families participating and one with quote unquote 60 families participating. This is going to impact your projections for the coming months. Additionally, we know that unexpected requests, damaged items, lost items, and many other unplanned things happen. It's vital to build in a buffer into your projections to account for those occurrences. As you move through the program, it'd be helpful to reflect back with staff to understand how well your buffer is working, if it can be increased or decreased, if it met the need, if you have an abundance of leftover diapers, or if you're doing just fine. In a perfect world, an initial assessment of your participants needs to be completed well in advance of the first distribution. We all know that might not happen, and again, we're going to walk through some strategies to help with those uh, situations where you don't have access to that information. But if you do, it will ensure that the procurement partner can provide you with the correct sizes for all of your participants on day one. There's many ways to collect that information, and we recommend that you use some type of spreadsheet or data management system to store this information in a universal location. In most cases, there are several different people editing this information, so it's helpful to have a process that allows for multiple people to access at the same time. This process can be done through a survey format at participant intake or during case management engagements. It's vital to maintain and update an active list of participants with their current and future diaper sizes. Again, this will allow your distribution needs to be matched specifically with the documented needs of your community. The information should be updated as participants receive their diapers and should be revisited at least on a quarterly basis to ensure the data is matching the actual need. Reflecting on the balance of inventory is a great way to assess how close the projections were to the actuals. And I kind of want to open it up to the group here and want to know if anyone has begun to collect sizes for participants, and what are some of the barriers that you have run into in that process?
Mary, feel free to come off mute.
Hi, everybody. This is Mary from Iowa Community Action Association. So we did what we were calling a baseline survey kind of back in December, January, where we had all the families we planned to enroll, basically as a Google survey, more or less, asking about current diaper size and estimated usage for wipes and diapers and all that. Of course, a pretty rough estimate. I know most folks aren't really counting how many they're using, but it gave us a rough start. And one of the barriers we've certainly run into is that it took a bit to get those done. And so, of course, sizes are going to change. So we tried to err on a little bit larger, but it, doesn't match up perfectly. But that helped us a lot just to get a baseline of what those needs would be to start out.
Wonderful. Thank you for sharing.
Justin, we also heard from Scott Cap asking about other unplanned occurrences.
Yeah.
Central shared weather. I don't know if you want to come off mute and share more about the weather concern.
I think that's a great item to raise. I mean, we deal with a lot of extreme weather, whether that's snow or rain or um, anything that is relevant to your geographical area. And sometimes that prohibits people from being able to attend and access these resources. So again, I think it goes back to my earlier comment of really planning for when someone misses, what your site plans to do with inventory. From our experience, a lot of distribution sites tend to have limited storage availability. And so it's really important to have a consistent flow of that inventory out into the community. So there's not a big backlog in your space. I think that's a really great comment. Thank you for sharing, Centrell, and thank you for sharing, Mary. Great. The tracking of a distribution partner's inventory should be done at the same rate of distributions. If distributions are occurring on a monthly basis, the data should be reviewed on a monthly basis to ensure your site has enough inventory for the next distribution. As discussed previously, using a spreadsheet or data management system will assist with the consistency and will be easily reviewed for accuracy. Requests should be made based on the remaining inventory and the period of time you hope to continue distributions for. Make sure to allow for a period of time for the diapers to arrive at your site. We recommend setting clear expectations with your procurement team about your distribution strategy and what specific dates inventory must be available. In the world of Amazon, we are reconditioned to expect items to be readily available, and when you're working with large quantities or bulk deliveries, those timelines are much longer. You don't want to run out of inventory, so ensuring these processes are set up will help with the consistency of the program. One of the most helpful ways we saw to review the data was using monthly or quarterly totals by size for the participants compared to what was actually distributed. Most months, you might not be able to serve everyone within your project, but these totals will allow you to compare your percentages of used versus the expected. This information can help guide future requests for your procurement team. The table here shows an average of what age and weight babies use for each size of diaper. It also highlights the number of diapers used per day by each size. Please note these are all estimates and based on averages. This table is extremely useful after you get a baseline of what sizes are being used by the participants, as it will allow you to project out over the next several months what you anticipate each child to be wearing. So I think going back to Mary's comment about doing that initial assessment and then acknowledging that distribution won't happen for several months, you need to project to those larger size. This, based on the age of the child or the weight of the child, will help you do that more accurately. Some partners may make an Excel file with the participants' ages or weights to help assist with those projections. This is something that could be manually updated, but mostly pre-populated with formulas. You could add 1 month to each of to the age of the child and automatically pre-populate the size that the child may use. Our experience is that participants lean on the side of wanting a larger diaper for the child. One, because they know that the child will not grow out of them, and two, they assume that more space will make the diaper more comfortable for them. Our agency uses the weight column more than the age range, as we found it to be more accurate. As babies mature at different rates, the weight seems to correlate better with the overall size of the child. One other item to note here is that not all diapers are the same size, and it's important to make sure the diapers you are procuring match the data set. This data can be found on the manufacturer's website or most times right on the box. This slide shows supplybank.org's historical averages. Here is an example of the distribution rate by size for the last few years of our programs. This is based on a statewide implementation across many different communities and agencies serving many different populations. Based on the partner and the specific population they are serving, this data may significantly shift. For example, if a partner site is aimed at serving 0 to 6 months-year-old, 6-month children, they will not have any of the larger sizes. It's important to look at each of your sites individually to ensure they have the necessary diaper sizes available, as well as looking at the project as whole to reduce the opportunity of stockouts. One of the things that we have learned from experience is that sites tend to do a baseline average across all the sizes. And what that does is if a procurement partner purchases diapers that way, and then 2 to 3 months later down the line, sites are using those higher sizes at a more frequent rate, it leaves excess inventory in those smaller sizes, as well as does not leave enough available inventory for the larger sizes. I want to ask the group if these percentages look accurate to you, and if anyone has noticed anything similar or different at their specific sites.
Do we want to pick a state to hear from, Justin?
Sure. Mary has her hand raised. Go ahead.
Oh,
Mary.
okay, great.
I was just actually crunching some data this morning for some agencies, and I'd say we actually see a lot more 4s compared to what this says. So I don't know if that's just a kind of meet in the middle somewhere, but definitely more on the bigger sizes than the 1, 2, newborn and 3s. But I'd say 4s are a higher percentage for us.
Great. And are the agencies that you're doing that data for, are they serving a specific age group, or is it universal kind of 0 to 4?
We are doing home visitation programs that are 0 to 5 for the most part. Yeah.
Wonderful. Great. Thank you for sharing. Anyone else? Similar or different experiences?
I see we have Washington with us. We also have West Virginia partner. Nope, just Virginia, not the West. I saw W. Scott Cap is also with us. If anybody wants to come off mute and share.
Hey, this is Marcus with SkyCap. I was going to
Marcus.
say along with 4s, also 2s here in South Carolina. So 2s are a big big commodity, as well as the 4s as well. So
Awesome. And similar question to Mary, Marcus, are your sites serving a certain demographic or age range?
yeah, certain demographic. We're focusing on some of the early Head Start kids, and so they start from being born to, I believe, 5, where they go to Head Start from 4 to 5, whatever. So it varies. So we have a wide range of kids to kind of choose from. But like I said, the 2s and the 4s are kind of where it is most needed, looks like.
Awesome. Thank you for sharing. I look forward to circling back in a year or so and see how these percentages may shift.
Definitely.
Great. And then, sorry. One thing I wanted to flag on the previous page is what we've seen as the percentage difference between the smaller and larger size. I think the anecdotal experience of Mary and Marcus may be a bit different, but through our work, we've found several reasons why larger sizes might be prioritized over the smaller sizes. Even though we know that the baby is supposed to be wearing those smaller sizes. One, larger diapers cost more. Parents will want to make the most out of the program and tend to choose larger sizes in order to save themselves money down the road. They may keep those diapers at home for future use and go out and buy their own. Additionally, when a baby is younger, there's usually more community support from the neighbors, family members, and friends. They may bring diapers as a gift to the new child or share their leftovers as babies grow out of them. The last item is that smaller babies can wear larger diapers. This means parents don't have to be concerned about the child growing out of the diaper if they're always getting access to a size or two larger than what the child actually needs. What we're working on is just projections. And even though we try our best to find, we sometimes find ourselves with excess inventory. Diapers are bulky, and using the strategies that we've discussed above should help you reduce your overall amount of excess inventory month to month. I recommend chatting with your team in advance about your strategies when you identify excess inventory and brainstorm ideas within the program to find a new home for those items. It may be helpful to set up a cadence on how frequently you set up a cadence on how frequently you revisit unused inventory. If there are not participants in your program using that particular size, you may need to find another partner program or families in your community who will have a use. Make sure those items are not allocated to a particular participant who is intending to come pick them up. Sometimes through donations, you may receive an abundance of sizes that do not fit your particular program. These can be used as great resources for incentives for parallel programs or holding on to them as the children in your program grow. We have found there's always a greater need in our community than unfortunately we're able to serve. So it's about being creative with your approaches to find the best home for all of these excess diapers. And lastly, just want to summarize what we've talked about here today. You really want to, as much as you can, set up that process early on and continue to revisit it. Understand that changes are going to happen, that excess diapers of certain sizes will always be around, but working to improve your process to mitigate those challenges. Mistakes and stockouts will happen. Unfortunately, some children won't be able to access the specific size that they need on that date. Being compassionate and understanding with your community, explaining the situation you're in, and striving to reduce those situations in the future. And I want to acknowledge you will get better as the program goes on. We know from experience that in the early stages, it was very complex and felt overwhelming. As we continued to implement the program, collect feedback, and gauge how we were doing, we made strategies that overall increased our efficiencies and reduced some of these barriers. So that's all of the content I have prepared today. I would love to open up the conversation to hear from individuals about what's going well and what are some barriers, and would love to talk through any of the specific topics that we discussed today. Not seeing any hands or seeing any comments in the chat. I hope that's a positive thing. Was the content that we shared relevant and helpful for people? Wonderful. Thank you, Mary. You can come off of mute, Mary. Feel free.
Hey, sorry, I feel like I've been dominating this conversation.
It's
But I guess a
great.
general question for, I don't know if you all can answer or if there's anyone on the call who can. We've been already thinking about the whole excess inventory piece because I know we have much time to go, but just worried about what we do if we have leftovers at the end. Do we know with this grant if we'd be able to just do more of a distribution drive at the end, so not having as much of the kind of consistent follow-up, but that way it still gets out to families who need it. We'd obviously track like what goes out the door, but just curious if others are planning to do kind of larger events like that, especially as things wind down a year and a half from now.
Yeah, I would love to hear from other participants. Is anyone else planning for the end and to have excess inventory at the end? Have they thought through that yet? Mary, I appreciate your approach of already considering kind of the longer term goals and where you'll be at towards the end to try to make the best use of the resources that you have available. I don't have the technical answer for you with regard to your ability to distribute to the larger community or like a kind of a less prescribed approach. I think I saw Patrice join the call. If she's still here and able to respond. Patrice, are you able to jump in?
Can you repeat the question?
Yeah, so Mary was talking about towards the end of the agreement, if they have excess inventory available, if they're able to distribute it to a larger group of individuals outside of their originally prescribed participants, or how they could use those resources within the guidelines of the agreement.
At this time, I do not have a response to that question. Mary, can you send that to me in an email and I will follow up with management and discuss it and try to get back to you with a response?
Can do. Thank you.
You're welcome.
Wonderful. Thank you, Patrice. Sorry for putting you on the spot.
No problem.
Yeah, Liz, come off mute whenever you feel comfortable.
Good morning. Thank you.
Good morning.
As I stated, we just officially started our program yesterday.
Congratulations.
We have had diaper distribution in the past through other funding. But of course, we're working on trying to concentrate on the case management portion of this one. We do have a major issue though, and that is our plan is to really push the survey with the first time served for these folks. But we found yesterday we had planned on using a tablet at our front reception, but we found out that the survey itself is locked to only one participant per IP address. And so since our whole agency has one IP address,
Right.
we were able to do the first survey yesterday, and that was it. So
wow.
I'm not sure who's in charge of that piece of it, but I think it's as simple as possibly kind of unlocking the Survey Monkey from that restriction of the duplication. But so right now, unfortunately, we're taking paper surveys, but even those we won't have the ability to input into the Survey Monkey because of the IP address issue. So I know that was introduced to Melissa yesterday. So hopefully, I don't know if anybody else is having the same problem. I'm kind of surprised that nobody else has mentioned having a problem because I know they've been at it a little bit longer than us.
So can I respond to that, Justin?
Yeah, of course.
So for the beneficiary survey, I received this question yesterday and I forwarded it up to make sure that we're doing the correct thing. The response has been is that the cache, CACHE, needs to be cleared each time, unfortunately. And the instructions for doing so in most computer-based web browsers to open menus used to clear your cache, cookies, and history, press Control-Shift-Delete on Windows or Command-Shift and Delete on a Mac. And there's actual instructions of how to do so. So what we can do is I will have this sent out to everyone so that if anyone else incurs this problem, then this would be the way to fix it. So we will get this sent out to everyone. Unfortunately, you are correct. The paper copies of the beneficiary survey is not, we cannot accept it. So therefore, it would need to be done by the computer. So for those surveys that you did receive, they would all have to be inputted into the computer in order for us to receive the survey results.
So yes, and we did realize that so we have the QR code on some posters and advertisements. So we have encouraged people to please go ahead and take a picture of that and do it on their phones, which is part of the intent anyways. But that is fantastic news. I'm glad that they found something, and I will turn that information. Did you by chance get to send email back to Amanda for that?
Not
With
as
those
of yet.
instructions?
I can
Okay.
forward that directly to this was sent to me from Melissa Hess. Is that
Yes,
yourself?
that's
Okay.
well, that's who Amanda contacted, yes, in Washington.
Okay, so I
WASCAP.
will forward this information back to Melissa, but it will also be sent out to all of the recipients as well,
Excellent,
in case
good.
anyone else
And
incurs this problem.
I did write it down that the cache needs to be cleared out with Control Shift Delete each time. So I'll go figure out what that means.
Wonderful.
Thank
Thank you
you
for
very
raising
much.
that, Liz, and thank you, Patrice, for having a response
Yes.
available so quickly.
You're
Yes,
welcome.
excellent. Thanks.
Mary,
wish
do you
us
have
luck.
something to add?
Good luck, Liz. Sorry, Christian.
Oh, I was asking Mary if she had something to add.
Oh, sorry. I was gonna say if obviously the clearing cache part would work, but another option if it's easier, like on that iPad or tablet, to open an incognito tab, then it doesn't always recognize that IP address. You might be able to do more than one. So if that's an easier solution than trying to clear that every time, you could try that out too.
Wonderful. I love the creative approach.
I do
Excellent,
think there's
thanks.
a setting, depending on what tablets you're using, that you can select that will empty the cache after each time. Also, I feel like I've done that with some surveys before, whenever I was wearing more of a marketing hat.
Great. Thank you all.
I am writing down all these great suggestions. Thank you.
And Liz, you still have your hand raised. Is there anything else you'd like to add?
No, I can take that down now.
Wonderful. Great. And I saw some discussions happening in the chat. Lots of celebrations as well, which is wonderful. Well, great. As sites continue to progress through this project, I know that you might want to revisit some of this content. As I reiterated in the beginning, we're here to help in any way we can. So some of the recommendations in this document is to build out some Excel spreadsheets or tracking software. If you have something in mind and you want us to take a look at it, we're happy to do that. If you want to spend some time together collaborating on something, we would be happy to curate that time as well. So please use us as a resource. Christian just redropped her email in the chat, so please save that and reach out if you have any questions or comments in the future. Happy to be in this space with you all and learn together. Excited to continue to bring topics to you all. So if also if there are topics that you have not seen on the future training schedule, reach out. We're open to recommendations and happy to accommodate where you think education would be helpful. To that end, I think we can close and everyone can have a wonderful rest of your day.